Hello, Brownsville. I'm Michelle Jones, the city epidemiologist, and I want to welcome you to BTX CARES Talks. And this is where we discuss important topics that are affecting our community. As you know, the COVID-19 pandemic is not over yet, and we are seeing additional cases with the more contagious variant known as the Delta variant. And so to provide us with the best information, we've brought along a special guest speaker that we've collaborated with and who's collaborated with other entities within the city. I'd like to introduce you to Frank Acevedo. He's the Chief Nursing Officer for Valley Regional Medical Center.
So good morning, Brownsville. Happy to be here, Michelle.
Thank you so much. So just to start it off, for those individuals who might not know who you are or about your hospital, do you mind telling us a little bit?
Sure. So my name is Frank Acevedo, Chief Nursing Officer. I've been at Valley Regional for 26 years, born and raised here in Brownsville. We've been in the community for over 40 years at our new location since 1998.
Oh, that's so great. That's a long track record of helping the residents with their healthcare needs. So one thing that we like to talk about are the frontline workers for COVID, and you are one of those frontline workers and the members of your hospital staff. And since the first cases of Brownsville have come in, do you want to tell us a little bit about what you guys are experiencing at the hospital?
So we have seen a spike in new COVID patients in our hospital. We've probably doubled what we had maybe about a month ago. And a lot of the people that we're getting now are unvaccinated. So maybe about 90% of those patients are non-vaccinated people.
All right, and so since you are seeing those increases, are you seeing some individuals that are vaccinated entering the hospital, or is this just almost solely an unvaccinated event?
So we are seeing a few people that are vaccinated, but they're minimal. The majority of the patients that have to be hospitalized are non-vaccinated individuals.
All right, and that's, are we seeing any differences in age groups or how you're seeing from the previous spikes that we saw at the beginning of the pandemic?
We're seeing younger individuals come in. So we see younger adults coming in that haven't been vaccinated or maybe not believe in the vaccination. So it's a little different because the vaccine was so readily available. A lot of the older population did come in to get their vaccines. So this is a younger population.
So when we talk about vaccinated versus unvaccinated individuals, one thing that we're kind of curious about, or that you can inform us about, is how severe is the illness if you do get it, if you're vaccinated versus unvaccinated?
Sure. So we still have some people that are vaccinated that come into the hospital, but they're not as sick. They're able to be discharged home with oxygen, right, and be monitored from their house. But those that are unvaccinated have to stay in the hospital because they get a little bit more sick than that vaccinated population.
One of the things we want to ask here is, what are your recommendations when it comes to the vaccine? Is this something that we're really trying to push and hammer home?
Sure. So vaccination is very, very important. Whatever your political view or personal view is that exponentially you can affect a lot of other people. It's not just yourself. So if you have family or friends that haven't been vaccinated, you're also exposing them. So I think it's really, really important to get vaccinated. So being vaccinated, wearing your mask, and sanitizing are really, really effective against COVID. The first time around, there's a lot of things that we didn't know. We didn't have a vaccine. Now we have that tool available today, and we really need to leverage that. That's really, really important. So I'm here to tell you that COVID is real. Being in the hospital, seeing how it's tasking, our limited resources available, I really urge the public and the community to take the vaccine seriously and get the vaccine.
Thank you, because
Yes.
that's one thing that the public health department has been really promoting also, is getting the vaccine. So it's nice that our hospitals and our public health departments are lining up on that and really pushing that message. We do know that some people are hesitant, and I'm assuming, which I might not need to, but that sometimes people enter into the hospital with COVID and then they're asking for the vaccine. How does that affect them? Because at that point it's too late.
Correct. At that point, it's too late. But even after contracting COVID, they can get the vaccine afterward. And I would ask you to listen to your health officials or your CDC and not your comadre. Because a lot of the patients that we ask, they're asking a neighbor or they heard somebody say something, is that they're not the experts, is that really trust what the experts are saying. And I'm here to tell you that based on what's happening here in our community, those numbers are rising and it is an unvaccinated population.
All right. So since we are seeing this kind of new trend of upward cases with the Delta variant, what are some of the ways in which the hospital is collaborating with like local health departments and other entities to help protect our community?
So I'm proud to say that everybody's working close together, the city of Brownsville, the health department, our EMS providers. We have calls probably 2 or 3 times a week to kind of update each other on what's going on. The hospitals, Valley Regional and Valley Baptist, are working really, really close together to make sure that if they get busier or we get busier, that we're sharing resources. That's something that COVID did, was that kind of brought everybody together, and that's a big plus. But the health department, the city, they really are keeping close tabs on us, and if we need anything from PPE resources or the current information, even vaccine allocations, they've been working really, really closely to us. So thank you all for doing that.
Thank you. Thank you. No, we appreciate everything that you guys are doing also, because you're so intricate or so necessary for the proper functioning and the welfare of our community, not only in COVID, but also when it comes to, other emergencies that arise and healthcare needs like car accidents or heart attacks or strokes. So we appreciate all that you're doing.
Sure. And now that kids are going back to school and the teachers are going back, is that we need to make sure that those parents are vaccinated, because there is something different now. We've added that component. So my message to the parents and the community is that if you don't have that vaccine, it's probably more important now, because we're going to see a large group of people go back to school.
And that's real important to note, because the vaccine, a lot of people don't realize this, but it is readily available.
Correct.
So you can get it at your local pharmacies, you can get it from your primary care physician. I know the city of Brownsville, we have vaccination events. One thing that we do have is every Wednesday we have a vaccine event at the Southmost Library, and that's from 5 to 8 p.m. And we do 12 years and older, so you do have the Pfizer, the Moderna, and if you request, we even have the one-shot J&J most of the time. And then we also have a farmers market event on Saturdays, and that's from 9 a.m. to noon. Those are just walk-up clinics, so you don't have to have an appointment. So I'm glad that you mentioned the vaccines here.
And I'd also like to point out that we do have a higher vaccination rate in our community than other areas, which I think has helped us, but we still probably have maybe about a 30% gap that we could close and maximize that.
Yeah, that's really important. That way we're not only protecting ourselves, but we're protecting those individuals who aren't able to get the vaccine. And mainly that would be those children that are under 12 years old, because the vaccine is not available to those individuals. And then maybe individuals like with healthcare conditions that have to put it off until they are healthy enough to receive the vaccine.
Correct.
So thank you for mentioning that. So one thing I want to ask you, is there something maybe that we haven't talked about or that's going on in the hospitals, maybe the strain and the stress, that we'd like to bring to the forefront and let people know about? Because this is a marathon we're running now, and you guys have been at it for over a year.
Sure. So because of COVID the first time, we lost a lot of resources. A lot of the healthcare providers didn't come back home, right? They stayed abroad or elsewhere. So if we fill the hospitals up with low acuity patients that could have, or less sick patients that could have benefited from the vaccine and didn't get vaccinated, that stresses the whole healthcare delivery system. So when somebody has a heart attack or they have a stroke and they have a life-threatening emergency, we don't want to tie up those EMS providers. We don't want to tie up our emergency rooms. This is not a problem that we have just here locally, but I think across the state, across the nation. So I really urge everybody, the community, to get vaccinated as soon as possible. I'm a Brownsville native. I'm proud that we can collaborate with everybody as well as we have, but we really need the community to kind of do what they can do to help all of us.
All right, I want to thank you so much, Frank, for taking the time out of your day to come on down and giving us this important information. Before we close out, is there anything that you feel that we might have left off, or a message that you really want the people to know?
Sure. So I think as COVID increases again, I think the community, the health department, all the healthcare providers, the city have been really responsive in helping the community, but now we need the community to help us in return. And I think that ask would be is that please vaccinate. If you're not already vaccinated, you're over the age of 12, please get your vaccine. That would probably be my message to the community. Thank you.
And so we hope the community found this information really beneficial and informative. If you still need more information, remember you can always go to the cdc.gov, and we have that wonderful COVID hotline number out there. It's 956-394-0012. And for BTX Cares Talks, I'm Michelle Jones, the city's epidemiologist, reminding you to stay safe and to stay sanitized.